Okay. Well, it's the given hour. I feel like I'm in a municipal council meeting because at 7 o'clock the hammer comes down. I guess the way it should start on time, but I'd like to call the meeting to order and make sure we have a quorum to make decisions. We have a quorum, that's fine. Then we have the agenda. Could we have someone propose we accept the agenda if that's can be found, it can be found. I need that gentleman to identify himself.
This gentleman?
Oh, yeah.
Tim Scamo, New Maryland.
Okay, moved by Tim, seconded by maybe another Tim.
Yeah.
And so anything on the question? All in favor?
Aye.
Raise your hand. Okay, motion carried. And we have an opportunity for anyone to declare a conflict of interest if there is one. And I presume there would not be, but in the case there is, they can do the proper thing. So item number 5 is on 211 presentation by Daniela Fernandez.
Good afternoon, everyone. Would you like me to start the presentation right away?
Yes.
Okay, excellent. So I'm just gonna share my screen so that you can follow along with my content. So hopefully everybody can see basically the cover of the presentation right now. So hi again, my name is Daniela Fernandez and I'm the Director of Community Engagement for the 211 New Brunswick service. I work with the United Way of Greater Moncton and Southeastern New Brunswick, but my role is to establish strategic partnerships with different players in the sector to raise awareness around 211 all throughout New Brunswick. So my goal for today is just to give you an overview of the service and highlight some features that I think might be helpful to support the work that the Regional Service Commission is doing in your region. So I'll just start by sharing some basic information for those of you that might not be familiar with 211. So 211 itself is an information and referral service that connects people to the full range of critical human, social, community, and government supports. And the idea is that the service helps people to quickly and effectively navigate the very complex network of community programs and services to help them find the supports that they need for their unique situation. The service is completely free and confidential, and our phones are answered 24/7, 365 days a year. And what's also wonderful is that we have the opportunity to answer calls in over 170 different languages, thanks to our interpretation service partner called Language Line. So if ever you're working with any newcomers or folks that might need additional support beyond English and French, we have the capacity to do that. And 211 is a service that's now available to everyone who resides within Canada. We are present in every city, province, and territory across Canada, thanks to some funds that we received back in 2020 to expand the service to the last 3 provinces that didn't yet have access to 211, which were Manitoba, New Brunswick, and Newfoundland. And since the service launched here in New Brunswick back in October of 2020, we have been able to ensure that well over 100,000 people who call New Brunswick home have been connected to the right supports and programs when they have faced different challenges in life. And one of the other things that we're also really proud of is the fact that the distribution of calls coming into 211 New Brunswick actually spans the entire province. So that actually speaks to us as to how well received the service has been, especially by folks in rural communities where access to services and programs can sometimes be a little bit more limited. So I'll share with you a couple of stories throughout the presentation to give you a sense of how the 211 service works and the types of situations it can support you with in collaboration with other service providers as needed. So in this particular case, a mother of 5 children called 211 looking for supports to feed her family. As the conversation went on, she shared that she wasn't working, her husband was, but unfortunately, he was acting violent at home. So immediately the community navigator asked if her and the children were safe, and the mother said yes. The navigator then asked if she had all of the resources that she needed in order to find supports around the domestic violence situation. And the mother confirmed that in fact, she was already connected with a social worker that was helping her to make a plan to get her and the children out of the home safely. So that was good. But if at any point during the conversation, the answers had been different, this would have been a very different call. So if they had been in any immediate danger, 911 would have been directly involved so that they could provide immediate support, and supports around domestic violence would have been made available to the mother. What she needed in that moment was help around food security. But now that we also had a better understanding of the big picture and the transition that she was navigating, we were also able to provide her with information on employment counseling, women's shelters, utility assistance programs to help her pay some bills, and even programs that could provide not only food, but also clothing for her children to make things easier for the family as they continue to make a plan to get them out of that home safely. So as you can see, we don't necessarily offer counseling directly at 211, but what we can always do is support individuals by connecting them to the right supports at the right time and by collaborating with other emergency service providers as needed to provide people with timely support. So while what I gave you at the beginning of the presentation is like the more technical definition of the 211 service, I'd like you to remember 211 as that best friend that you can call anytime with nearly any concern and who will actively listen to you with empathy and without judgment to guide you through your options so that you can find the resources that you need for your specific situation. We know that life doesn't throw challenges at us at a convenient time. So it doesn't matter if it's, 3 a.m. on a Sunday, first thing Monday morning, during the holidays, you can always rest assured that 211 is there for you. So how does the service actually work? As you saw by the last example, when someone contacts 211, they're going to be connected with a real person, not a robot, not an answering machine. We know this can be deeply frustrating for any of us when we try to reach out to a customer service line. So the one choice that you'll be asked to make is if you want the service in English or French, but beyond that, you will be speaking live to one of our resource navigators. And that person will simply listen to you to understand what you're going through. They'll ask some simple questions to clarify what you qualify for, and that way they can refer you to the right programs or services to help you with your situation. What's also great is that oftentimes callers can even be registered for some eligible programs on the spot during the call, which eliminates the added stress of them having to make follow-up phone calls and follow up with other agencies. And then another little known fact about 211 is that we can also offer a callback service for vulnerable callers. So this is something that we can offer on a case-by-case basis. But basically, if our navigators are speaking to someone in a really challenging situation who has very little social supports around them, we can ask for their consent and their contact info so that we can call them back sometime 48 to 72 hours after they reach out to 211. And that way we can ensure that the information and referrals we gave them actually got them some support. And if for some reason that didn't happen, we'll take down that information to so that we can keep track of the unmet needs in the area, and then we'll expand our search to explore further options to get them some help if that didn't happen. Similarly, we can also offer some additional supports to callers on a case-by-case basis, such as supports filling out online application forms for certain government programs. We can transfer their calls directly to the appropriate service or office to get their questions answered, and so on. So we really are more than just a directory. Our goal is to help people to navigate the system of social supports to facilitate access to the services that people have available to them. So really, that's the magic of 211, that human touch and compassion that our navigators are able to bring to the service. They listen actively and with empathy to understand callers' needs, and that empathy and expertise can make a real difference for callers that would otherwise feel lost or overwhelmed, just trying to navigate the myriad of community resources all on their own. We've probably all had that experience of trying to look up information online, but then having to filter through pages and pages of information just to try to figure out what's the right fit for our situation and what we're eligible for. So really, our 211 navigators are there to ease that burden of research for you, whether you are someone in need or a service provider looking to address clients' complex needs, whatever capacity that may be in. Our navigators are not volunteers. They're actually fully trained professionals with backgrounds in social work, counseling, or psychology. And this makes them really well equipped to work with all kinds of people who come from marginalized situations, people in crisis, situations that need escalation. And they also know how to collaborate with other essential emergency providers or other helplines as needed to ensure that people receive timely support for their challenges. And as you can imagine, our navigators have to undergo extensive continuous training to become experts at community and human service navigation. This is a field that's constantly in evolution. Programs and services come and go depending on funding, staff capacity, and so on. So this is very much a collaborative effort between 211 and all of the partner agencies in the sector who can always come in and offer training to our navigators to help them understand the existing services and programs out there so that they can make the right referrals at the right time when people call 211 looking for help. So I'm going to tell you one other story just to illustrate how the service is actually really flexible, because people can call 211 on behalf of others, whether that's a person in need or a client or a loved one, a member of your community that you're concerned about, and so on. And the reason the service is flexible that way is because we know that it's not always easy to reach out and ask for help or to articulate what you're going through, especially when you might be struggling or when English or French might not be your first languages, and so on. So we allow people to call on behalf of others, and we'll always give them information about the supports available to the person that they're looking to support. So for the story, in this particular case, a father called 211 on behalf of his adult daughter. So she had lost her job throughout the pandemic and had to move back into the family home. And he simply called to understand how he could help her find a way to live more independently in the community again when she was ready. While the community navigator was looking up some resources, the father started opening up a little bit more during the conversation, simply to add that his daughter was also really struggling with her mental health. He mentioned that she was seeing a therapist once a week, but it seems like she needed some additional supports. The navigator then asked if this was another area where he would like to find some resources, and he agreed. So at that point, the navigator at 211 was able to expand her search to include not only affordable housing options and employment counseling resources, like was the initial ask, but also resources to help the daughter cope a bit better with her mental health. So as you can see, that's the value of having someone who can really listen and who cares enough to help address these complex needs, because life's challenges don't often happen in isolation. So I also just want to remind you that there's no limit as to how many questions or concerns any caller can bring up during a conversation to 211. If somebody really needs to talk about, say, mental health, access to food, and job counseling, like employment counseling on one call, we can tackle all those three things. If they're feeling overwhelmed and they prefer to take things one step at a time, we can always meet people where they're at, and they can always call us later the same day or the following day, just so we can kind of guide them through other supports available when they're ready. Now, while it's really important for me to tell you what 211 is, it's also very important for me to tell you what 211 is not. So there are limits to the work that we can do. So one of the things that's most important to remember is that 211 is a non-emergency response line. So really, we are a complement to emergency responders like 911, for example, but really we act as more of like a one-stop shop for all kinds of non-emergency calls and requests for information. Now, if someone does call 211 in a moment of crisis, our community navigators will support them, but they'll aim to de-escalate the situation based on their training. And in that case, their objective would actually be to make a direct transfer to the appropriate, say, crisis helpline or 911 as needed, for example. We want people to call the right number to obtain immediate support during a crisis, but if they don't happen to know what that number might be, then 211 is able to help, because that's what we are. We're the front door to help, so we'll connect people to all of the other social supports available to them. But the other thing that's really important to remember is that we are not a crisis management or a counseling service. So our navigators are not trained to offer advice, but rather they're able to connect people to all of those other human, social, community, and government resources. So what they can do is provide information and referral. Now, just to give you some examples of the main kinds of programs and services that people are most often looking for when they reach out to 211 and that we can connect them to, they include lots of things, primarily what's on the screen, but even more beyond that. So things like financial assistance programs, government benefits, access to food, shelters and housing supports, supports for seniors and caregivers, job training and employment counseling resources, affordable housing subsidies, newcomer supports around settlement, language classes, things like that, mental health, supports for children, youth, parents, single parents, transportation to medical appointments, legal aid, you name it. So really, in a sense, 211 is a great resource for like that everything else category that other information and response lines are not always able to address to that same level of detail. And that also means that the ways in which you can help support the 211 service are also incredibly broad, from telling others about it, to calling on behalf of loved ones or clients looking for support, and even to helping us evaluate which resources might need to be updated in our database so that we can always make the right referrals at the right time. It really takes a village to help ensure that everyone has access to the help that they need, This is a very complex landscape, and people's lives also evolve in really complex ways. So 211 counts on everyone's support to build trust for users and the resource organizations that rely on our referrals as well. Just really quickly, I want to highlight how it is that 211 can specifically support service providers, because I don't want you to walk away with the impression that we're duplicating services or reinventing the wheel. So really, we're more than anything a complementary service to the hard work that many organizations are doing to provide services and support to people on the front lines. And really what we want to do is to help free up some of their staff time to help them focus on what they do best, which is to serve their clients. And we want to do that by easing the burden of research and navigation so that service providers can focus on what they do best. So I like to give an example of how several years ago, I used to work as an employment counselor for newcomers to Canada. And oftentimes during my conversations with my clients, instead of being able to just focus, say, on their CV, their interview prep, labor market research, we also needed to talk about whether they had children and how old their children were, whether they had already found access to affordable childcare. We needed to talk about housing and whether they could find a place close enough to their job. And if not, whether they had transportation to and from their job. So I found myself doing a lot of research on the side of my desk, trying to support my clients, but I was kind of spreading myself really thin because I didn't really have the time or the resources to know about everything else that could support them and improve their job search outcomes. Now we have a resource like 211. And so our goal would be to see someone in that same type of role say to their client, I know that there's all these other needs and concerns that might impact your job search. So let's focus on these 3 things that I can address. But for all of those other needs, let's call 211 together, or feel free to give them a call anytime. They're available 24/7 in 150 languages and so on. So again, our ultimate goal in that sense is to allow organizations and staff to provide holistic services by connecting their clients to additional support for complex needs that organization might not be able to meet otherwise based on their capacity or their expertise and so on. So already about 40% of calls to 211, not just in New Brunswick, but across Canada, are calls that are being made by professionals and resource organizations. And it's 211 that's allowing them to be able to say yes to people when they need additional supports that their own organization might not be able to provide otherwise. Similarly, we can be leveraged, like during staff vacations, holidays, office closures. We encourage people to talk about 211 in their voicemail greetings, their email signatures, and so on. Because again, we are a 24/7 service, so we can always help to connect people to supports when local organizations might not be available to do that directly. A couple of quick things I want to highlight is that, we really do want to make it easy for agencies to send us their profile information so that we can list their programs and services in our 211 New Brunswick database. And so we have made improvements to our website so that people can do that on a self-serve type of basis. So if you ever go to our website, mb.211.ca, and you go to the Contact Us page, you'll see links there to either submit a suggestion for a whole new program or service that we still haven't listed on the 211 database, or you can suggest edits or changes to an existing profile. Maybe their address has changed, or they've launched a new program, or their contact info is no longer correct, things like that. So we really want to encourage you and all of your community partners to be proactive in letting us know about all that information so that we can continue to build trust for people that rely on 211 to connect them to services. And the other thing I want to quickly mention, which might be really, really interesting to your group, is that 211 has been collecting aggregate anonymous data based on calls to 211 since the first day we started operations in New Brunswick, so October 15th of 2020. So now we're going on 4 years worth of really fascinating data that tells us where people are calling from, what they're calling us about, and what their needs are, whether there's any unmet needs in their particular community and where the gaps in service are. So really, this could be really fascinating data for your team to dig into to help inform community decisions. That's how we would really like to see that data be used, so that if there's any particular projects or funding or research that you might be able to do to help to understand what's going on in your community and how you might be able to help fix some of those issues or those trends that we're noticing, then feel free to browse through that data. It is publicly available at 211expansion.ca. We simply ask that if you will include that data in any official documents like funding applications, community reports, anything like that, please contact us first so that we can help you make sense of the data and tell you how to cite it and things like that. But you are always welcome to browse that information to help you understand some of the projects that you might want to undertake in your region based on local needs that we see through the 211 service. So almost last but not least, I just want to highlight, life can be hard, but finding help doesn't have to be. 211 is a tool that was truly built for everyone. Everyone can call. It's not just for older adults. It's not just for children. It's not just for service providers. Anyone can always pick up the phone and dial 211. And remember, help starts here with our service. So there are many different ways to contact the 211 service, as you'll see on the screen. Of course, the easiest to remember, most intuitive one is literally just dialing 211 on any phone, and that should connect you to our navigators to speak to them about what you're going through or what you need. We also have toll-free lines available, one of which provides video relay service capacity. So for folks who are deaf or hard of hearing, who need to use video interpretation to communicate using sign language, that's the best number for them to use through VRS Canada Online. We also have a teletypewriter line, similar service for folks who use a teletypewriter device. We can also always answer emails. You can send us emails at 211mb@findhelp.ca. So it's the same navigators that answer calls that would reply to those emails. So they really are the experts at programs and services available to you. And that might be easier if you want to receive information in writing about what you're looking for. We also have our website, which is very much like Google. It's a search engine that allows you to look through our database of programs and services. We have some guidance and tips for how to refine your search by clicking on the How to Search tab. We have a clipboard where, as you're browsing through resources, you can sort of save and park your favorites so that you can refer back to them later. And on the website, you can also chat online during the hours of 8 a.m. till 10 p.m. Monday through Friday with a community navigator in case you have questions about programs and services you're finding on the website, or if you need support navigating the website. And as of April 2024, this year, we recently launched our brand new 211 Canada app. It is available across the country. What's going to be different about the app is that it has a different type of search engine that allows us to use natural language processing to bring up results. So all that means is that instead of having to know like the specific lingo that we use in the sector to find, for example, food security resources, anyone should be able to just use the app and type things like, I'm hungry in Fredericton. And just by using everyday language like I'm hungry, that'll cue the system to bring up all the food security, meal delivery programs, things like that, that person might be interested in. The chat from the website has been incorporated into the app, so it feels very much like texting back and forth with a navigator. So there might be some demographics like youth that might be more interested in engaging with us like that. And then, of course, you have the whole directory of resources at your fingertips, so it's easily shared with other people. You can take screenshots, look at resources on a map, and so on. So we really think that the 211 Canada app is going to change the way that people engage with our service. I quickly want to give you an idea that we might be able to explore in a different conversation, but we do have specific supports for service providers. So if there are any community partners in the room that may be interested in this, feel free to get in touch with me later. But we are able to provide, orientation and training agreements to service providers that have, say, hired a whole new batch of staff. We can come and train them on 211 and the ways that they can leverage our service to support their work. We can set up e-referral agreements so that if you're able to support clients with some needs, but you want to refer them to 211 so that we can kind of connect them to additional resources that your organization doesn't provide, then we can have a specific secure kind of pathway to do that through an e-referral agreement. We have the capacity to make warm transfers. So you can either transfer calls to us, but we can also transfer them directly outbound to government agencies, community agencies, and so on, so that we can make it more seamless for people to get their questions answered. If you're looking to do a community asset mapping exercise, which I know a lot of folks like to do, we discourage you from starting from scratch. We're happy to provide you with customized resource lists so that you can see what is already available in your community. And that way you can let us know if we might be missing something or if there's something that's no longer applicable in your area. So we can start by sharing those customized resource lists with you and then go from there. And then, of course, we can always provide collaborative promotion and mutual support since our work can feed one another. So if there's any resources that you think we might be able to provide to you to help us promote 211 and we can do the same for you, that's a conversation we're always willing to have as well. And I just quickly want to mention that if you're interested in helping us to promote the 211 website, there's a toolkit that you can download from our website anytime, which includes key messaging, widgets for your websites, printable resources, social media, captions and graphics, anything that you might be looking for in terms of promotion. But if you would like us to put something together more customized for a local newsletter or a magazine article, something very specific, feel free to get in touch with me, and I can always put that together for you as well. Just really quickly, I'll highlight the partners that make all of this possible, in particular here in New Brunswick, the government of New Brunswick, which includes social development and ESIC, the 3 regional United Ways that exist in New Brunswick, the St. John Human Development Council, which has a really special partnership with us because they hire 2 full-time database editors, and that's their entire job, to make sure that the database of programs and services we maintain is fully up to date. And I'm including broadly community organizations and yourselves, because again, this is very much a collaborative effort. So you're referring clients to us, you can help us to spread the word about the service, and you can also help us to ensure that our database is up to date by helping us to verify information and resources in our database that might exist in your area that you might be more familiar with. So in that sense, you are also now part of the heart and soul of 211. The last thing I'll say is that the 211 service is actually trademarked to United Way all across Canada. So if ever you have an opportunity to make a donation to the United Way Community Fund, it's you that's helping to ensure that someone gets the help that they need. And it's you that's helping to ensure the continuation of this essential service in our province and in our community. So thank you very, very much for your time. I'm going to stop sharing my screen unless you want to take down my email, but I can also put that in the chat. And then if you have any questions for the next few minutes, I'm happy to stick around and answer some of those before you can continue with your meeting.
Okay, thank you, Daniela. That's a lot of information.
Indeed.
And I know navigation from the numerous services that are available is very important for New Brunswickers.
Absolutely.
But I understand you train people who become navigators, but how do you get those people?
That's an excellent question. Recruitment has been challenging in New Brunswick because we do need navigators to have, once again, a background in either social work, counseling, or psychology, and they need to be fully bilingual in French and English because they will be responding to calls in both official languages. We're actually in the process of recruiting 3 extra navigators. We do need to increase capacity for our New Brunswick team based on increased needs and demands. So really, I mean, helping us to spread the word about those opportunities is always helpful. We also do post on Find Help Information Services. Their own website has the job listings that are available. We post on Career Beacon, Indeed, LinkedIn. But I think even promotion through some of the local colleges that would train some of these folks with counseling backgrounds and things like that might be another effective way to recruit people. But yeah, really just letting people know about those opportunities is always helpful so that they can find out not only more about our service, but about the fact that they can come and work with us if they wish.
So there may be others here who have questions, and I do see David Hayward online. And David, if you don't mind, we can change our roles when Danielle is finished. Would that work for you?
Absolutely.
Okay, thank you. So are there other questions for Daniela? This is an important addition to ways to help our population.
On that note, I do have a couple of questions I would like to put out to Daniela.
Sure.
Fantastic presentation.
Thank you.
Very, very complex network that you have created. It covers so many bases.
It does.
On that note, how you mentioned that different service providers can become part of that group and become a resource for those using the service. So may I ask, and one of the points you had mentioned was a ride program for medical appointments and so on. So for more rural communities, are those resources equally available for those, or do you have challenges with those on occasion? I'm just curious if I get some of the mechanics of how that flows.
Yeah, absolutely. So 211 is just the connector, right? We can only connect people to resources that are actually available in their community. So you've touched on a really important point. In more rural, remote communities where there might not be a program, say like urban rural rides, for example, we may not have too many options in terms of connecting people to those transportation supports when they need them. In those cases, we might be able to expand our search to a larger geographical area and see if there's a way to make those connections and provide transportation for that person looking for that service. Or we may be able to connect them to local organizations where they might be able to agree to do some of those supports on a case-by-case basis. But that's also why it's important for us to document the unmet needs. So you bring up a really interesting point, because someone might call us and we might do a search and we might realize, hey, there's actually not a service that can meet your needs in your area. Let us look beyond your area and see what we find. But we'll still document the fact that there is no service to meet that specific need that caller came to us with. And that's where that statistics portal I was talking about can be really helpful to organizations like yourselves, because you're going to be able to see that we have an extensive document that already tracks some of those gaps in service. So that might tell you, well, if we see that there's a lot of calls in the capital region from people that really need this particular service, and there's no organization that meets that need, well, what could we potentially do in order to help fill that gap, right? So that's where we might not be able to specifically provide a solution to the issue, but by providing data and backing that up with evidence, we may be able to help eventually create better supports for people in that region, through organizations that might be willing to fix those gaps or to provide services to meet some of those local needs. So yeah, it's not always equitable across the board. It really very much depends on what services are available from region to region across the province.
Okay. So the data you mentioned, there would be so much information within that data that could be drawn to each individual community as well as the different groups.
Yeah.
That would be a significant amount of data, I suspect.
Absolutely. So
So
on the portal, sorry, go ahead.
And how could that be? How could we connect with your group to start going through that, to maybe identify some gaps, to try to bridge those so that you'll have those services as resources for the people that are making the calls?
Yeah, absolutely. So again, the portal is always available online if you wanted to just at least browse it and sort of get a sense of the types of data that we currently have. The unmet needs data is already one of the charts that's publicly available. I think it's at the bottom of page 1. There's about 4 or 5 pages of data. I'd say the first 2 pages are the most relevant. But yeah, the data can be filtered by either, obviously you can look at the whole province at a glance, but you can also filter the data by county or by individual municipality. We've yet to match our data with the new boundaries around service commission, because all the boundaries are different, right? Health zones, school boards, regional service commissions, it's all very different. So we've stuck around with just the simplest, like municipality, county, that's it. So if you really want to go through the exercise of trying to at least get a picture of what's happening regionally, you can easily filter the data yourself on page 2. We can always set up a meeting after this for me to kind of guide you through how to do that if you'd like. But that's the idea, right? Is that you'll be able to see that there might be some provincial trends, but in specific regions, the top 3 needs that people are calling 211 about might be very specific to that area, right? Same with the unmet needs. Obviously, it being the capital region, there's less likely to be a lot of unmet needs compared to rural areas, but we might still have documented some about people asking for very particular services that are just not available where you are. So that's where we hope that by studying some of those patterns and seeing some of those trends, even over time as they've changed over the last 4 years, that's where groups like service commissions can say, okay, well, clearly there's a big need around this. No one's meeting that need. What projects or partnerships can we develop that might be able to help fill that gap? So yeah, absolutely. We can talk about that in more depth, or you can always take a look at the portal online. And if specific questions come up, you can always reach out to me. And I'm basically like the interface between the public in New Brunswick and our service provider, who has even more data behind the scenes to share if you were looking for something very specific for your community research.
Thank you. You actually answered my next three questions through that. So thank you
Awesome,
very
thank
much.
you. You're welcome.
Thank you, Don.
Thank you, Mr. Chair. The two notes that I made that I put big stars around were with respect to data and also to the asset mapping. As we go through our process to develop our specific community development strategic plan, which is on our horizon, I see, well, first of all, we're very data thirsty. So I'm looking forward to an opportunity to have a look at the 211 data and also the asset mapping, because I think they overlay our objectives in community development very well. And so I'm looking forward to subsequently reaching out
Absolutely.
to Ella about how that can inform our plan and particularly the data on unmet needs as well.
Yeah,
So,
absolutely.
So the committee can be sure that we're going to make connections in that regard.
Excellent. We look forward to hearing from you.
Anyone else have a question for Daniela?
Yes, I've got a question. Is this a tool that's often used by MLAs and ministers? Seems to me that this had become quite an important one for constituency assistants and people all over the province that are trying to get answers for people and trying to get services. Is that one of your customers, I guess?
I would like to think so. I mean, over the last 4 years, I think we've done 2 provincial campaigns where we've specifically sent letters and packets of information and promotional materials to all of the MP and MLA offices and constituency offices across New Brunswick. So they are aware of the service. I would think that it's more the folks that staff the constituency offices that are often asked a lot of questions about community services and so on. So they might be the ones more directly referring people to 211. Or again, they could also call 211 themselves to be given a bit of a list of resources, so to speak, that they are most often asked about. There's different ways to leverage the service. So I would like to think that our elected officials are referring people to 211 as well, because it's an easy place for them to send people to when they've got a variety of questions that they might not have the direct answers to. But of course, more awareness is always needed. Like 211 is a very particular service in the sense that unless you need it, it's sort of easy to just not keep it top of mind. So the more we can reinforce the messaging and remind people that 211 is a resource that's at their disposal, the more likely we're to build momentum around its usage. And the more momentum we're able to gather around the data that we can collect, right, with increased use and so on. So if you have ideas for helping us to promote to key people or networks in your area, please, please, please reach out anytime. We're very keen to support that as well.
Daniela, what I can offer for you is that Ministers Ames and Wilson recently had information events for seniors.
Yeah.
And so I promoted information on 211 there.
Thank you.
We've just had a couple of community events in the Grand Lake area. So I cross-promoted 211 with Urban Rural Rides. And
Excellent.
we've got a Seniors Expo coming up next weekend. That's
yes.
put on by the city of Fredericton. And so I'll be taking your materials there too.
Thank you. I'll actually be there with a booth myself as well. So
Oh, good.
I'll see you then. Yes. Thank you.
I need more material.
Excellent. I'll bring you extras.
In case, yeah. Oh,
Thank
and
you.
United Way does too, because I cleaned them out.
That's fair. I need to do a restock in the region. Thank you for letting me know.
Great, thank you.
Thanks.
Are there any more questions for Daniela? Well, thank you very much for that very informative presentation.
My
And,
pleasure. Thank you so much for having me.
You will be hearing from us.
Excellent. Look forward to it. Thank you. Have a
Thank
great
you.
rest of the day.
Thank you,
Bye.
Daniela.
Bye-bye.
Thanks. Bye.
Okay, David, it's all yours.
Thank you very much. I apologize for being a minute late there, and I appreciate you getting things rolling. So the next item on the agenda is the GIS project. Lise and Jenny.
Okay, so I'm going to start the presentation by just giving a quick introduction as to how we started this. As you know, one of the 8 initiatives that we had previously presented to the committee was the faith-based community development project. So our hope is to develop relationships and a network with all the faith-based organizations, churches, synagogues, mosques, prayer buildings. There are all kinds. When I was doing my research, I found all kinds of names. But basically, getting the contact information, the mailing address, email, website, and information on all of these in a region, by entity, so that we can share information back and forth. Because a lot of times in rural areas, the first people that get the knock at the door when somebody becomes homeless or becomes hungry or needs services is the church, in a lot of places. And a lot of the volunteers in different communities, not just rural, but in the city as well, are people at the church. And there are a lot of strong outreach programs that come from these churches. And again, in the spirit of not wanting to sort of reinvent the wheel and to share information, I think this would go a long way in helping people all over our region. So we're waiting for the okay from the board and the entire package to see if this will go through. But in the meantime, I thought it would still be good to have a distribution list by email that goes to all the churches in our region. I should say faith-based organizations. And also a field, a document in Excel that can be used to do a merge, I guess, for letters, for correspondence, so that if you have, a letter, you merge it with all the addresses and do a mail out. And that is something that has already a few of our nonprofits have approached me and said, do you have that ready yet? Because I could really use that distribution list. I'd like to send out an email. What I may do is just sort of be the central contact and just say to these people, send me what you want to have sent out, and then I'll email it to all these churches in the area, because I'll be the one who'll be getting, if there's a wrong address or a missing address or whatever, I'd like to maintain this list. So I started inputting this information, but then what I did, and this is where Jenny will give a bit of an explanation, she actually mapped out these churches and faith-based organizations. So I'd like for her to give you a little introduction of as to what this looks like, because for you visual learners like I am, it just blew me away. It was nice to see where the clusters of churches are and which regions we're communicating with. So if you will, Jenny?
Yeah. So can the people in Zoom? No, you have to share your screen. Oh, so can you? Yes. Sorry. Yeah, hello everyone. I'm Jenny. I'm a Chief Ed Technician of CRSC. So today I would like to make an overview of a demo map of the CRSC local churches and organizations based on the database that we have so far. So on the left-hand side, you can see we have a list of the local churches and the organization. And it's around 129 organizations. So in the list, you can just click on a random organization, for example, this one. And the map will bring you to the exact locations of this. You can zoom to click on the symbol. And the table will pop up showing the basic information, basic informations of the judge. For example, like the entity, the name of organizations, the address, the website, phone number, email as well, and the locations. So in here, the website is have a view, so you can click in here, and it's gonna bring you up to the church's website. And you can find more detailed information in this website. Yeah, so for this, you can scroll down or up to get more locations. So we have a searching bars in here as well. You can search the judges and the organizations by name. So for example, here I want to, know where is the terrorism persons before judges. And clicking here, I can click, and here you get the location that you are looking for. So yes, so the same, you just click on the symbol and get the basic information of the judge. Yes, I know that on the map. So this map represents our boundary, the CRSC. And in here we have the boundary of difference, mixed body, the entity. You can click in here and you can know which area you are in. And in here, we also have a searching bar. So in this searching bar, you can search by the mixed body. Again, so for example, to see how many judges in the Symphony Yorkshire, clicks in here. Yeah, and it's gonna bring me up. So. Yeah, so in here, I can take a look and know, how many judges in this area. And yeah, you can click and find the information of, the locations. Like this. Yeah, so, that's an overview of the map, that we have so far. So, right here, you can see, we have the mixing data of the email and phone numbers in some, locations. So in the near future, Lee's gonna, contact to, different organizations and get more information. And then we can make the map, more comprehensive, in the future. Yeah, thank you so much.
Thank you. Thank you so much, Jenny, for doing this. Jenny's a whiz. She really is. She's an IT whiz when it comes to this stuff. And she has prepared similar maps for other things here since she started working here. And I don't know, I think this is going to be a good tool to have. We'll have to decide on how, and when we want to share this and for which purposes, but for our own use right now, I think it's going to be valuable in trying to find out where the clusters of people are. If we want to meet with a community, do we go by entity, do we go by area, or anyway, but once we start having our quarterly or monthly or whatever meetings, I think this will be a really valuable tool. I don't know if anybody had any questions?
One comment I would like to make, is this something that could be available to 211?
Yeah.
It seems apropos that it would be to have this conversation now.
Yeah, sure. I mean, I don't think there would be any objections. All the information was obtained from Google. It's all information that is public. So I can't see why, if this is something that would help them, absolutely, we'd be all about sharing that. So they could help, not just our region, but other people too, to find out what's going on, and if other people are moving to our region. And somebody may want to replicate this for the other regional commissions, But yeah, I don't think there'd be any reason not to. I'll write that down too.
Any other questions? From around the room or online? Yes.
Hi. Yeah, so I guess my question is right now it's internal. Will it become external? Will it become something that the public can access at some point? And do you think that would be okay with the churches?
As long as I'm thinking, the only disadvantage I could think of is that if churches start receiving a lot of spam, you know what I mean, or whatever, but I'm thinking this is a tool that we could probably have as part of our website. So that people could go and access this information. I to just share it with organizations, if not the actual map, the actual Excel spreadsheet with the information so that they can do a mail merge. And one of these organizations was Nursing Homes Without Borders, without walls, Nursing Homes Without Walls. They appeal to seniors who are living at home, who may want to go into the nursing homes to do, you know, various activities. So I could see myself sharing this with them. I could see myself sharing this with other organizations that want to target seniors, urban rural rides, for those looking for rides, but also for those who would be there volunteering to give rides. So I think it's something we could share as needed, and maybe it could rest on our website for people to come and use as a tool. Not sure, we've not yet talked about, you know, how far we want to share this, but yeah, the only potential negative side would be if you know, I don't know, telemarketers or somebody decides to send them a lot of junk mail, but they can find that from the internet anyway. All these addresses were found using Google, so.
But as it stands, this is all public information, correct?
Yes, it is.
Yeah, it was all access, yeah.
Yeah, and maybe that's why I'm missing a few email addresses, you know, and I will make sure that when I call the churches to find out, you know, the phone numbers, and is it okay for this to be shared publicly? I found it on Google, or if not, let me know now so that I don't add it to my tool. You know what I mean? If they want to reach you, they may have to send you an old-fashioned letter, for example. So we'll give them the choice to do that.
Or a lot
Thank
of the
you, Louise.
websites use a form. right?
Yes,
You have to fill
I
it.
noticed a lot of them, they just have contact us to get away from that, you know, probably, so,
Yeah,
yeah.
yeah.
Maybe that's why
I
I was.
hate those.
Yeah, me too, me too, but they're smart to do that, I
They
think.
are.
And then the CAPTCHA or whatever, I'm not a robot, yeah,
Yeah.
smart.
Any other questions for Lise or Jenny? On that note, I guess the next item would be Suzanne on the E6
That's
stats from the latest consultations.
That's for last, right, David? So this is an exciting time of year in the E6 cycle, because we're actively out doing that pulse check to find out what is the situation relative to economic and social inclusion in our province, otherwise known as poverty. What do we know about the current state? What do we know about what the situation is as described by the experts, both those who are living in that situation and those who are trying to support people living in conditions of poverty, and what is happening around the world, so that we can understand what the best practices are. So thank you for your attention to this report, because this is a preliminary take on what they've identified so far. So I'll take you to the highlights. Starting with slide 3, Kelly, you were just at it, yeah. So to understand that process, they actively engaged people through questionnaires, through phone calls, through surveys, through online avenues, to provide their comments on what they saw as the situation of poverty in New Brunswick, what needed to be done to improve it, and what role they played, what role business played, and what role government played in making a difference. As well, we held consultations, conversations in communities, where people came together and talked about what poverty situation looked like in their own backyard. As well, there were targeted stakeholder meetings where they brought in the experts in our region and said, share with us what you know to be happening on the ground and what pathways you see forward. And taking all of that data, they then did a validation to ferret through it. What are the high points? What are the things that are rock solid? What are the things that we can build our next 5-year strategic plan around? So on the next chart, sorry, correct. There we go. So the high point there is Capital Region Service Commission 11 had the highest rate of online responses to the questionnaire and the highest participation rate in our focus groups. Celebrate that. Okay, let's go on Kelly to slide 7. What did we hear? So when you took all of the comments and you kind of put them into some buckets based on common themes, the biggest bucket was affordable housing. So I'm not telling you anything here that's surprising, shocking, or questionable in your mind. Next was access to affordable childcare, which is an issue for a whole variety of reasons, and matched as well by lack of sufficient income. So if you're having challenges meeting your basic needs, it's usually because you turn to your wallet and there's nothing left there but dust. The next item that in priority is food security, followed by access to public or reliable public transportation, but the word I'd like to put in there as well is affordable. Followed by access to mental health and addiction services, access to activities, and others. So this was just trying to give some perspective on where some of the target areas are to focus attention when they're doing the regional plan. And on our next slide, this is really insightful because it's taking the comments and helping to see what are people in our community saying. And again, ranging from people with lived experience through to the organizations on the ground providing the support, through to the government who's developing the policies, through to businesses who are trying to figure out what is their role in helping to create vibrant, sustainable communities. And so they, again, categorize them under these 4 headings: housing, social inclusion, transportation, and self-sufficiency. Housing, the basic message there is you're always going to run into challenges if you're looking for the private market to resolve the issue of affordable housing, given that it runs against the profit motivation, which is natural. So the people who attended sessions provided comments, etc., try to make suggestions around new ways of providing shelter, which speaks to co-op housing, which speaks to finding more affordable accommodations through rent caps. It means coming up with mixes of housing solutions. For example, having matching up seniors with students at universities, seniors who need help shoveling the driveways with students who need affordable rent, and maybe someone that knows the community can help them feel connected in a strange place. And how can we think outside the box? The other thing that to find those year-round solutions so that we're not always running out trying to find warming centers in the summertime and cooling centers in the summertime and warming centers in the wintertime, only to replicate it again 6 months later. So what's the year-round solution? What was really exciting for me, and I know Tim, you heard it in conversations in NACWIC and in Hamlet, sorry, and Bob, you heard it in the Millville sessions particular, was the people there trying to say, what's my part in creating solutions on poverty? And that's where you start coming forward all these comments about providing more kindness, more empathy, trying to find ways to open doors for people that are looking for pathways out of poverty. We're challenged with the fact that people are feeling socially isolated. And when you're isolated, when you feel that you're all alone, you don't want to ask for help. And then if you do want to ask for help, you don't know where to go for help. Which is interesting, tagging this in after our 2-on-1 conversation. Mm-hmm. So those little problems that were just a molehill all of a sudden become a mountain, and people are drowning in debt, lacking options for employment, struggling with transportation. So before those molehills become mountains, how do we engage our citizens in being part of the solution, as well as our employers? And so that's the comments here that you see in this bucket kind of relate to those themes. The next bucket on transportation is, of course, speaks to improving the quality of the service, the ability to get from point A to point B in an expedient fashion, doing it in a way that's affordable, particularly for people on low income, where they're considering the fact that they're the ones most reliant on public transportation to get around. From our folks that we talked with at a recovery center and living in transitional housing, they also pointed to some issues they have with stigma in community. And how they're perceived when they do actually reach out for services. So that was enlightening and insightful. And then the last piece speaks to how can we help people move forward, leveraging the existing skills, their talents and abilities that they already have. How can we create more opportunities for job training? How can we help them find more gateways to employment and overcome barriers they may be facing on language and basic skills? Find that affordable health care. And also it ended up, usually I know this spoke to finding ways to improve the living wage, make it more a living wage, and basic guaranteed income support. So that's a quick overview of the report. What I can say now is that EZIC has gone through the analysis phase. They're going to be meeting with all of the SIN coordinators, myself and all my counterparts across the province, to further do that validation, to help us to understand what kind of direction that they're proposing to take back to the government, and do that check-in with us to see if that really lines up with what we're seeing as issues in our own communities, and are open to receiving comments from us on further direction. The release of the Overcoming Poverty Together plan for the province is targeted to happen around the January, February timeframe, of course, subject to getting it approved by government. So stay tuned. We will soon see what the provincial plan is, and that becomes our guidepost for understanding what our regional plans and priorities should be. It will also point us to what funding support we can receive through ESIC funding sources. And I went to 103, I apologize.
Thank you very
Yes, sir.
much, both for pointing that out and for the presentation.
But happy to answer questions.
Any questions from anyone in the group? As she mentioned, we are actually over time. I'm not sure how everyone's schedules are, however. Yes, go ahead.
Okay, I just, not really a question, but I just wanted to commend Suzanne. I think one of the reasons why Capital Region Service Commission had the most participation is because of Suzanne's work. So in fact, I know that's why. So I just wanted to thank you for that.
Thank you, Tim. Thank you. Most appreciative.
Great work, Suzanne.
Thank you.
Any other questions?
I appreciate I moved you to the document really quickly. So if you'd like a coffee and a chat sometime, I'm available.
Can that be sent out to the group, Suzanne?
I think it was in the package, yeah.
Oh, yes, that one was, sorry.
Yeah. How
And,
fast was that, David? Instantaneous.
and the slideshow from 211, is that available to the group as well?
I will obtain that. I'll get that from her. Yeah.
Thank you. Any other discussion or questions for staff? Nothing from anyone. On that note, can I have a motion to adjourn?
I move to adjourn.
Seconded?
I'll second.
Perfect. Thank you very much. Enjoy your afternoon, everyone.
Thank you.
Thank you.